Today, I will be giving a brief overview of Chapter 10, Aerobic Exercise Prescriptions for Public Health, Cardiorespiratory Fitness, and Athletics. When it comes to aerobic exercise and prescriptions for public health, some individuals may need medical evaluations before beginning an exercise program. There are 3 levels of risk: low risk, moderate risk, and high risk. For low risk, men under 45 and women under 55 should have no more than one risk factor. These risk factors include coronary artery disease, smoking, hypertension, obesity, sedentary lifestyle. For moderate risk, men 45 or older or women 55 or older have 2 or more of these risk factors. For people with high risk factors, these individuals are usually known with cardiac, pulmonary, or metabolic disease, or symptoms suggestive of cardiac, pulmonary, or metabolic disease. Exercise prescriptions must be modified to meet the individual needs. Everyone who participates in physical activity should warm up before and cool down afterwards. Some benefits of warming up are increased movement of blood flow through your tissues, making muscles more flexible. There's also an increased delivery of oxygen and nutrients to your muscles, and it prepares you for your stretching. A thorough warm-up helps increase the blood flow to working muscles, which results in decrease of muscle stiffness, reduced risk of injury, and often improved performance. Warming up also prepares your heart for an increase in activity, preventing a rapid increase in blood pressure. An effective cool-down helps to clear lactic acid from the blood, prevents blood pooling in the lower extremities, which can cause dizziness, and it helps maintain and increase muscle and connective tissue temperature, increasing flexibility. There are also different modes, intensity, duration, and frequency of training necessary to improve cardiorespiratory fitness for all ages, from adolescents to the elderlies. When encouraging fitness, it is important to know who you are working with. If they are children, it's important to not beat them into the ground, as they should get an hour of physical activity a day. Their bodies are still growing, so as long as they are involved with an activity, if it is swimming, running, or jumping, they will be strengthening anaerobically their muscles and bones. Adults, on the other hand, are different and can endure more physical activity. For substantial health benefits, adults should exercise for about 150 minutes each week of moderate intensity aerobic physical activity, or 75 minutes each week of vigorous intensity anaerobic physical activity. Older adults should follow the same activity guidelines, but seek to improve balance, more to keep active enough to increase their overall well-being. They should do activities like swimming or golf. When exercising, you should exercise 3 to 5 days a week. Moderate intensity at least 5 days, vigorous at least 3, or a combination of both. After exercising for a period of time, it is important that you continue to do so. Being consistent is important. The training can result in decreased cardiorespiratory fitness in as little as 2 weeks, and in a loss as almost as improvement in 10 weeks. There are primary physical factors that determine endurance performance in athletes. For athletes, training is more specialized and complex than those for general public. Athletes must train at higher intensities for longer durations more frequently to perform at their best. Athletes perform a greater volume of training rather than non-athletes. And athletes must use a mode of training that mimics the sport in which they compete.